Hello, everybody. I'm Maxine Silva, host of Building Bridges, Discovering Your Path to Peace. With these difficult times that we're having now, dealing with COVID-19 coronavirus and the pandemic, endemic, epidemic, we will discuss the clarifications of each of these terms. It's hard not to be emotional. It's hard not to be fearful. It's hard not to go to the refrigerator and binge eat, me in particular being isolated. So we decided that we should listen to our professional, our healthcare professional, Dr. Christine Sauer. You all may know her as Doc Christine. And she has her own website called
health-seekers.org.
health-seekers.org, where you can tune into her on a regular basis, and I hope you do. Christine is originally from Germany, and actually, first of all, hi Christine, how are you?
Hi Maxine, I'm doing great. I'm fortunate. The house is warm, we have to eat, we even have toilet paper.
Wow. Oh, now who did you leave none for?
I didn't binge.
Oh, but you brought
I didn't even buy any toilet paper. We have enough for another week. Then we have to go out get some.
Thank you to you and Mike, your husband. So anyway, let's talk about these things, please, Doc. When they're talking about pandemic, endemic, epidemic, what do these terms mean exactly?
Well, I want to mention to start with that what we are talking about is just general information to explain a little bit of the background. And please go to your government's public health website to get the newest information and the rules and regulations. Because whether you agree with them or not doesn't matter. We are law-abiding citizens, we follow the rules. Yes. And the analysis and blame game can come later. It will probably, the media will find somebody that's, it doesn't make any sense. It is what it is.
Yeah, absolutely.
So, the term pandemic, epidemic, endemic comes from the Greek, and endemic means within, demic, within a disease within us. It's within a very narrow country, for example. The yellow fever is endemic to South Africa.
Aha.
It is not everywhere. It doesn't spread because it is transmitted by a certain kind of mosquito that is just in this area of the world.
Right.
Then there's an epidemic. An epidemic is an outbreak of some infectious disease within a confined region. For example, in Canada, every year we have a flu epidemic. Mm-hmm. It goes around. Some get it, some not. If you're lucky, we got it's included in the flu shot. If not, our immunity deals with it, and some people sadly will pass on. And that's an epidemic, but it's not all over the world like we have it now. And a pandemic is, pan means everywhere. That means the whole globe is affected. Millions and millions of people are affected. And no country really can help another country because they are all affected themselves.
Sure.
So that's the situation we are in. But you can argue there's not just infectious diseases that cause havoc in the pandemic, because there's obesity, diabetes type 2, heart disease, mental health issues.
Yeah. And people don't realize that because we are in the throes of somewhat of an hysterical reaction to all of this. And this is where the messages get misinterpreted or are incorrect. So it causes a lot of confusion in people's minds.
Yes, and that is so true. And we'll get a little bit into the statistics a little later, because I'm known as a voice of reason. I I don't take really sides. I try to take what's there and filter out what makes sense. Like Judge Judy always says, if it doesn't make sense, it's not true.
Yeah. Yes, that's right. She's a very wise lady, Judge Judy.
Yes.
Yes, yes. So now, Christine, so we had over the centuries Spanish flu. We had H1N1 and Ebola and SARS much more recently. What's the difference between the coverage of those diseases as opposed to coronavirus slash COVID-19?
Oh, that's a very interesting question, because really it gets compared not just with what you mentioned, but also the Black Death, the smallpox, and then there was a pestilence in the Middle Ages. And it doesn't make sense to compare it. Now let's look during the so-called Spanish flu in 1918. The governments tried to do the same that we are doing now, isolate the people as best as possible. In spite of this, millions died worldwide. And it was a very virulent virus, like the COVID virus, very infectious. But at that point, there were many less people in the world. Now, why did still millions die, and especially younger people? Because at this point, medicine was not as progressed as now. And most people died of pneumonia caused by bacteria that went on top of the viral disease. And no antibiotics being present, people passed away from pneumonia at that time. They passed away from all kinds of infectious diseases. We are so spoiled. We think pneumonia, if bacteria hit us, we just take a few pills and it's gone. That wasn't always so in history.
So should we be concerned about a bacterial infection on top of the viral one at this point in time, even though we do have antibiotics? Would it complicate things? And what is the possibility or probability of that?
Absolutely. I can't say anything about the probability, but if you belong to a vulnerable population, which we'll get into later, if your lungs are damaged by smoking, toxins, or other diseases, asthma, you have a higher risk to not only getting severe pneumonia from COVID-19, but also getting a super infection, which it's called. That means an additional infection by bacteria, hopefully treatable, but this can lead to people being not only admitted to hospital, but to intensive care and having to go on the ventilator.
Okay, what are the symptoms of COVID-19?
Now, the symptoms are really not much difference from a flu or a bad cold. It can vary from none at all to sniffles, to a sore throat, red eyes, a cough, fever, muscle pain all over, to pneumonia with trouble breathing, up to septic shock. Most people experience any flu as a usual bad cold. It seems that this COVID-19 has a higher likelihood, I should say, to produce severe illness. Now, that can be a statistical fallacy, because who do we test? We test people with symptoms. In the beginning, we tested people with severe symptoms on the verge of death. And then we had the death rate of 20% of the tested people. And we said, oh my God, it's just as bad as a Black Death, which, by the way, had a 50% death rate. But 20% is pretty bad. And then they tested people with symptoms generally, and the death rate fell, because now there's people with a regular immune system.
So it's a larger pool to draw
There's
from.
a larger pool, and it fell to about 5%. And now it's about 1% death rate. Now, a regular H1N1 flu had about 0.5 to 1% too, where we had no, what they call herd immunity. That means the general population has never been exposed to that virus, which we are all prepared for if our immune systems function.
Right.
So
right.
I expect when they really do studies later, when the testing capabilities are better and test a representative sample of the community, that the death
Mhm.
rate from COVID-19 will be about the same as the one of H1N1.
I see. Well, I was listening to the news this morning, my usual MO, and they were saying that there are no tests in the United States at present, although in other the parts of the world there are, that will detect whether you have been uh, exposed to the COVID-19 and whether you have or have not immunity to it. Now, interestingly enough, back in early January, I had what I thought was the flu. I had a fever, I had body aches, and I had a cough.
Pretty bad
And I
one.
remember, you remember that, Doc?
Yes, that
Yeah.
was pretty
And
bad.
I remember going to bed at night and saying to myself, thank God I don't have any phlegm, anything in my lungs, so at least, or no nasal congestion, so I can breathe through the night. Who knew? Maybe it was the COVID-19 that I have. I would be anxious at some point to know if I could get a test to find out if indeed I was infected, and if so, do I have any kind of immunity? Can you speak to that?
Absolutely. Now it takes about 4 to 6 weeks to create IgG antibodies that last for a longer time. Not everybody makes antibodies, so some people can get easily reinfected. And the viruses, the flu viruses generally tend to mutate. So even your antibodies don't catch them 100%. They might catch them to 50%. It's like a key that doesn't fit properly to the lock anymore. So those tests are, of course, already there, but they are not widely available because the only people where they need it right now is for the tests to build a vaccine. That's how a vaccine gets judged. Do people that get the vaccine build antibodies? So they have to have, when they do vaccine development, they have to have a test for antibodies. You bet they have that in the States. It's just not available widely because they have to limit the healthcare resources, and it doesn't make a difference to most people.
Mm-hmm. Yeah, yeah. I mean, it would for me in that I am cloistered away in my apartment,
Yeah, it
lovely
would
as
give
it
you peace
is,
of mind
and
that you
not
can go
going
out.
anywhere. And but then I probably freak people out anyway. If I was immune, right? Or then which would also mean I wouldn't be able to pass it on. But
Right.
you know, that's for another day.
Yes.
So what what are the first lines of defense if as we're all in our own little bubbles and whatever and not supposed to be out walking the streets and potentially contaminating other people, what can we do?
Now, the first line of defense for any infection is strengthen your immune system. Eat well. Eat, if they're available, fresh veggies and fruit. If not, frozen is a second good option. Take additional vitamin C, up to 2 grams is safe unless you have liver or kidney disease. Get some sun, real sun, not behind the window, but don't get sunburned.
Mhm.
But of
Mhm.
course, avoid contact with other people if your immune system is damaged in any way. Ask your physician if you think it is. They can tell you more individually. This is just general info. And if you have questions, what foods are best for your immune system, I suggest you get my book, Eating for Vibrant Health and Explosive Energy, which is on Amazon. It
That's a
shows you
very good
exactly,
resource.
thank you, it shows you exactly which foods you can
Yeah,
select in our current world for your best health generally and a solid immune system.
yeah,
So
yeah.
the second line of defense is physical distancing. I don't like the term social distancing. We are socializing, but we are physically distant. And of course, what they say, the hygiene measures.
Yeah.
wash your hands the right way. There's lots of videos out there for at least 20-30 seconds with regular soap. Doesn't have to be antibacterial. Soap kills bacteria, viruses, funguses, all the bad stuff. Don't wash your whole body with it. The hands are enough. Don't touch your face.
Right.
Because if you touched a surface and it contains a virus, and then you touch your mouth, your nose, your eyes, everywhere where there's water-covered surfaces, epithelium we call it, or a little scrape on the skin, the virus can enter there. It mostly enters through the nose, through the mouth, through the eyes. And from the eyes, there's a direct connection to the back and the sinuses and the back of the throat. And that's where the virus starts to multiplicate in the beginning. And you're the most, actually the most infectious a day or 2 or 3 even before you have symptoms, if at all, and about 5 days after you start to have symptoms. That's why in England, they only put you in quarantine for 7 days. But we go the safe route because some people are infectious for up to 14 days or even longer. And that's why we are careful, because I think the main reason is we don't want to overwhelm our already strained healthcare system.
True. Now, the way that the virus is passed from one person to another is through the air, is through droplets, whatever, from your mouth or nose or whatever, cough, but within a certain amount of distance. But then again, that's why they pick the 6 feet or 2 meters, right?
And it sounds awful, but we all, when we speak, anybody who speaks in the direction we speak, we project droplets about 6 feet ahead of us, whether we like it or not. So if you talk to somebody face to face, you always, all the time, all your life, you showered them with little droplets.
Some people really spit.
Yeah, some people really spit. And sometimes it's a problem with their dentures.
Oh my. Well, so once the virus enters your mouth, nose, eyes, or whatever, then explain where it goes, what happens, and the life of it, and how does it get eliminated or die or whatever.
Yeah, okay.
How do we get rid of it?
It's interesting because a virus, as opposed to a bacterium, can't multiply by itself.
Okay.
A bacterium, you can give it an agar medium, which is basically algae, and it will multiply by itself. A virus.
Question, if a bacterium is a live organism, but a virus is not.
No, well, yes and no. It depends how you look at it, because the virus, to multiply, needs a complete cell that it can take hostage.
Okay, but it's not itself that it needs that host.
Right, it needs a host. That's why when they grow a virus in the laboratory, they have to grow it, for example, on an egg.
Okay.
Because there are cells in it. That's how in our vaccines, in some of them, the egg protein comes in, because they grow it on eggs, because it needs another cell to be able to hijack this cell and force the cell to produce even more of the viruses, like the Borg, and the viruses then lead to the cell bursting, and then they infect, they hijack other cells and do the same to them. So that's where the symptoms come in, because your cells burst from the virus, and the injury causes their glands to produce mucus, and you get the sniffles. And then they go from your nose and mouth down the windpipe in the bronchi, the big windpipe, the pipes in the lungs, and into the lungs. Do the same there, if your immune system hasn't already started to take care of them.
Mm-hmm. Mm-hmm. So if you are a relatively healthy person, your immune system will kick in and will address that foreign object within
Yes.
you.
And it will happen fairly fast. Within a day or two, your immune system recognizes, hey, there's somebody here that we have to take care of. He's hijacking our cells. And
right.
there comes the squad, the police squad of white blood cells, and basically eats the whole infected cell and destroys it.
Okay, so the white blood cells eat the virus.
Basically, yeah. They eat the virus and
Or
then
they eat
they
the cells that have been
expose it.
infected by the virus.
Sometimes they take it with them. Some white blood cell take it with it, expose it to the lymphatic glands. That's why sometimes the lymph glands swell.
Yeah.
So that the lymph cells say, okay, we look at it, how can we best react to it? And then we have specialized cells that build antibodies. Those antibodies of the IgM class come within a few days. As soon as they are multiplied enough, the body is ready to do that, they attack the virus and your infection is gone.
Okay, so they kill it basically.
And
so
it's
I know
interesting because it is good when you get a fever. People think they have to squash a fever. They have to take Tylenol. They have to take aspirin to get the fever down. The fever is not the illness. It's not the cause. The fever is a reaction of the body, and it helps to kill the virus and other microorganisms.
yeah, our
Because
bodies are very
microorganisms,
smart.
just a moment, I'm so into it.
Yeah, well, you know what? I know this is getting a little technical, but I think that our audience is relatively sophisticated with all of this in the media and everything.
Oh, yes.
Now. So it's good to talk about these points so that people understand the mechanism.
Yeah.
And that our body does have its natural defense mechanisms in place, and that if you are not compromised in any way, that your body will be able to fight this, and therefore most of the cases will resolve, maybe
Right.
with sickness along the way, but will resolve, right?
And if you have no other illness, a high fever, even up to 40 for 3 days, 4 days, is good. It keeps you in bed. It gives the body the rest it needs to focus all its resources on the virus. That applies to children too, especially to those over a year. Under a year, I'm a little bit more careful because they are one of the risk groups. And some of them get fever cramps. So if they get fever seizures, well, you have to lower the fever to avoid those.
Sure.
So it all depends. And if you ever have a question, if fever is dangerous for you, ask your doctor. But it's not without consequences to lower a fever that is meant to kill the virus, because the virus can live longer when you have no fever.
I see. Well, that's good to know also. And so do all COVID-19 cases end up with pneumonia?
Absolutely not.
Okay.
Most COVID-19 cases look like a flu, maybe a bad flu. I would say, I'm not quite sure about the exact numbers, look them up on the website, but pneumonia, less than 5% of the tested, maybe 10% of the tested. I think they say 7% of the people they test, and those are the ones with the symptoms, end up in the hospital. So they probably have some form of pneumonia. And 1% overall at the moment of the people tested passes on.
Okay.
And those are overwhelmingly people with pre-existing conditions.
Yes. Now, regarding healthy people, the virus may or may not react in different ways with different healthy hosts, right?
The body
Right.
interacts with the virus in different ways, yes.
Yeah. So it's not a cookie cutter approach to this, even for a healthy person.
Right.
So when do you seek medical help?
Now, that's a good question. And the medical help should always be searched when you are not sure what's going on, especially if you're immunosuppressed or old and you feel really sick, have a high fever and cough or muscle pain. then it's time here in Nova Scotia to call 811 or your local number first. And if you have trouble breathing and can hardly speak, please call 911. Then it's time to call the ambulance. You need oxygen and God knows what else.
Yes.
And if in doubt, call 811. Always follow the advice of your healthcare professionals. They are up to date on the newest information, hopefully, and they know you if it's your family doctor. And even in the hospital, they have your medical file. And if you're immunosuppressed, if you're old, if you're a very small child, ask your doctor, ask your professional help, and make sure you get the assistance you need.
I see. So if you know that you have been in contact with someone who's tested positive, what should you do?
For one, isolate yourself. Right now, most provinces are in quarantine. That means we have an emergency, so we have to quarantine ourselves if we were in contact. Mostly Health Canada will contact you anyway. And stay away from everybody and stay home. Don't even go out, except for maybe in front of your door if nobody is around, for 14 days. Those are the measures that we have been prescribed. Avoid the spread. If you belong to a risk group, or in any case, watch for symptoms, but don't be paranoid about it. Sometimes when you come in the cold air, the nose runs a little bit, or after you eat, your nose starts running. You eat a hot soup, you feel hot. That's not COVID-19. Stay on a level ground.
Yes. Well, some things are definitely worth repeating. So would you tell us again, when are you most contagious if you should be testing positive?
Well, you are most contagious really before you have symptoms, 1 to 3 days. That's why they want all of us, symptoms or not, to stay home as much as we can and no more than 5 people gather and want the physical distancing. And then you are contagious for another 3 to 5 days, sometimes longer. That's why we are self-isolating or staying home or quarantined for 14 days in Canada and North America.
Now, I'm going to ask you a question that could have political implications, but so what? It's okay. We do that, don't we, Doc?
Absolutely.
So we're looking worldwide at different countries in the way that they have dealt with this virus, with some amazing, devastatingly horrible effects, and some that have worked out relatively well in the overall picture. Our neighbors to the south, the USA, is sporadically and piecemeal handling this situation. It's very frustrating. I watch a lot of the US media, and I'm thinking, why don't they just get together, have this lockdown, quarantine, whatever you want to call it, in one shot, whole country, and so everybody is treated in the same way, so that the peak, which is a rolling peak they're talking about, going from one area to another area to another.
Flattening the curve so that we don't overwhelm the healthcare system.
Yeah, but I, in my humble opinion, and I'm asking you from a medical perspective, in my humble opinion, I think it would make more sense. Let's clamp down, do everything that we can, get it over with as much as possible to suppress the overwhelming cases that are coming in for our healthcare institutions, to try and help where it's really needed, so that we don't have that rolling peak. So the seclusion will not continue on and on
forever.
and on, right?
Yeah, that's a big issue for the economic downturn that we are seeing currently. And I mean, being born in Germany, I have a hard time understanding the Americans and their fierce individualism too good, because we should always look for the good of everybody. We are all one.
Common good,
We
yes.
should look out for the common good. And one of the ways we do it as citizens is follow the law. And when the law says do this, do it. If the law says your speed limit is 30, keep it.
Mm-hmm.
That's our duty as good citizens. And I'm a fierce good citizen trying to be. Nobody's perfect.
Yeah.
And we are so fortunate to live in a democracy. And in the States, I have a feeling, and I may be totally wrong, that many people put their individual fun, well-being, wishes over the well-being of society generally.
Mm-hmm. Mm-hmm.
And coming from a Germany, which some in America call a socialist country, it certainly isn't socialist, but it is a social democracy, even more than Canada. And
But now, Christine, you and I live
now
in
I'm a Canadian and I love Canada. And actually, Canada found a pretty decent balance between the individual well-being and rights and the communality and helping those that are less fortunate.
Well, you know how I classify Canada? I'm sorry, I don't mean to be tooting our
Go
horn.
for it.
Democracy with a heart.
I love that. With a maple leaf heart.
It's totally true. And now I lived in the US for 38 years. My children are born there.
That long? You're not
long.
that old.
I was very young when I got there. But what I'm saying is my heart is there too, because I have a lot of good friends and family, and and people get the wrong impression of Americans as individuals or as a whole, whatever. They're beautiful people. The Constitution of the United States is just an amazing piece of
Yes.
legislation.
And it may be the media that propose it too much, and the media can do a lot of harm and a lot of good,
Yes.
depending what they do. And I must say, we were in Maine the beginning of March, and we're in self-isolation, obviously, because of that. The people we met there were very reasonable, friendly, nice people. They were scared, but nice people.
Yeah, true. Now, the thing is, regarding the media too, yes, there's a lot of hyper reaction and whatever, but I do believe this, that there are people in the media with good intentions, with good hearts who feel frustrated because they want people to understand what's going on. They want people to do what's right for the common person and for all of us as a unit. And we live right next door, so they're our closest neighbors, of course, and they're. But here's my other take on all of this. I come from a spiritual perspective, that good old Mother Earth has thrown us an opportunity to go within. We can't help but be by ourselves individually, and maybe this is time for us to really look within ourselves and find out, okay, what can I do to make things better, not only for others, but it starts with me. So my peace comes from my looking within and realizing there are certain things that I can control and certain things that I cannot. And my being a control freak, this is tough for me, but I'm managing to do it day by day, except for the running to the refrigerator, etc. That's tough. And but then guess what, Christine? I figured out what that is. My going to the refrigerator and eating a lot is to squelch feelings that I don't want to deal with, to come to the fore because they're too painful. So I, just like with overeating for lots of reasons, but particularly now, what don't we want to face? We don't want to face our own mortality.
And it's interesting. I watched an interview, I don't know if you know him, with David Kessler, the guy who co-wrote the classic book on grief and grieving. And he said, he explained that the uncomfortable feeling we are all got in our hearts right now is really grief. We are
Yeah.
grieving for the people who are suffering, who are dying, a grief
Yes.
for a world that has changed, and a grief in anticipation of more change and uncertainty. And that's a lot to process.
That's
And there's
really true.
and he mentioned that there's 5 predictable stages of that process. And I will just tell them because they're so good. The first one is denial. This virus won't affect us.
Yeah.
The second one is anger. You're making me stay home and taking away my activities.
Uh-huh.
Then comes bargaining. Okay, if social distance for 2 weeks, everything will be better, okay? And then is sadness. I don't know when this will end.
Mm.
And in the end, hopefully, we reach acceptance. This is happening. I have to figure out how to proceed.
Yeah.
And after acceptance, he mentioned, comes meaning. Meaning when you look back at the challenges and find the ways in which they make you stronger, wiser, and invited you to rise to the occasion. Now, isn't that said beautifully?
Yes, and you know what? In retrospect, we see this because we must first introspect. That's where the retrospection will
Yes,
come if we do that inner work. That's what I feel, you know.
yes.
And
And
what happened to me, the moment of sadness came over me today. I was watching the television and I
mm,
heard of the death of Dr. James Goodrich,
mm,
neurosurgeon in New York, who actually separated conjoined twins from the brain, and miraculous work. You knew of this, Christine, right?
yeah, I knew of
And the
this.
tears flowed. And I thought to myself, wow, what does this mean? Well, I do know what it means for me, having lost my own daughter. But
Mm,
Christine, you and I are going to have a special episode on death and dying and our attitudes about it. And so
yes.
I hope that people will tune in, look forward to us going forward and dealing with those issues that need the light shone on them, that are difficult to digest, but are absolutely necessary for our survival and our thriving.
Wow, Maxine, you said that beautifully, and it is so important. And I want to say I made a special blog post with a link to download a workbook that helps you to do the introspective and find out what new normal do you really want?
Yes.
What do you want the future to be? Because now we have a chance to reconsider and maybe start something that helps the planet, helps us, helps everybody. I hope that will be happening.
Mother
So,
Earth is crying for us to do that.
yes, and I mean, when you see the maps, how the pollution went down, it is really humbling. Now, I don't know what's going to happen when the economy crashes, which is happening, but we will get through it somehow. We are strong as a race. We are lots of people that can work together. Let's work together.
And let's keep in touch.
Yes.
Let's do these videos. And anybody who has any issues, questions, concerns, who just wants to comment, be in touch with us, please. That's what it's all about. You're not alone. We're not alone, even though we are in our own isolation at the moment, but it's for good reason. So
And
let's reach out that way.
before we close, I want to say, please, if your mental health is affected, reach out to your neighbor, reach out to your doctor, or just someone you know who doesn't like to ask for support or help. Offer a listening ear, practical help if you can. Don't judge others when they feel sad or anxious. It is their reaction. But keep up to date and, of course, follow the advice and regulations of the government agency. But don't watch the news channels 24/7. Do other things too that lift your spirit.
Yes,
And
yes.
here, if somebody hears this show or podcast video or needs a listening ear or a helping hand, please reach out to me. My email is christine@docchristine.com.
Wonderful. Thank you. Thank you. Thank you.
Thank you, Maxine. You're a wonderful person yourself. We all experience grief in our lives. We all experience change. we all experience our mortality, and never more than when Dr. Strang stands on the TV screen and says, this is a deadly virus.
Yes, and it's okay. We're grieving now. It's
Yeah.
okay to grieve, and this too shall pass. Thank you,
Yes.
everybody, for being with us today. God bless.
God bless. We'll
Namaste.
see you again. Namaste.